So the next 3 diet patterns I'm going to talk about is keto, which is low carb, high fat. The keto diet is for people that have neurological conditions such as epilepsy. It can be good for cancer patients, can be good for people with metabolic syndrome, dementia, other neurological diseases, weight loss. With the weight loss, type 2 diabetes, metabolic syndrome thing, it is not a permanent thing. You should not be on keto permanently unless you have a neurological condition, because your brain is fat. So you need more of it for it to do what you want it to do. And a lot of the nerve endings go through fat channels. So that's why it's high fat, low carb. But it's not something to be on for a very long time. Okay, then we have intermittent fasting and time restricted feeding. They're similar but different. They can improve cardiometabolic and neurological benefits. It can be beneficial for those who can't sustain a ketogenic diet. Again, you should not sustain a ketogenic diet unless you have a neurological condition. Intermittent fasting is something we've all heard of. There's a bunch of different ways you can do it. I only recommend it short term. Again, unless you have a prevalent disease that needs to use that. Time restricted feeding is a lot less, it sounds restrictive, it's less restrictive, because I don't like to restrict anything unless we absolutely have to. It is an eating pattern based around circadian rhythms that occurs within a limited time span. So it's like 8 to 12 hours, and then you eat every 4 hours and you pay no attention to caloric intake. But you just, that is the time frame that you eat in, and that is it. A lot of us probably eat within a 12-hour window anyway. I think the max most people eat in is a 16-hour window, unless you're eating all day, every day, in 20 hours, which should not be happening. But that's another eating pattern. Again, none of these should be for long periods of time, so like years and years and years and years and years, because that's just going to lead to disordered eating patterns and habits and food scaries and just metabolic disruption. Again, unless you have a specific disease that needs to be on one of these. Any questions about different types of diets, feel free to drop a comment.